GLP-1 medications have completely saturated the market today, providing a highly effective, predictable tool for rapid weight loss. Telehealth clinics are now shipping these weekly injections directly to doorsteps, making them cheaper and easier to get than ever before. But dropping weight quickly on these medications triggers a biological trap. Without medical tracking, rapid weight loss simultaneously consumes fat and vital lean muscle mass. This chart breaks down the composition of unmonitored GLP-1 weight loss. It shows that up to 40% of the total weight you lose can consist of muscle mass rather than fat. If you are only looking at the number dropping on your bathroom scale, you are missing the damage being done to your metabolism. Protecting your long-term health requires knowing exactly what kind of weight you are losing. Elevate Health Group is a physical wearable practice based in Southern California, offering a specific approach from their clinics in Glendale, Burbank, and La Cañada. They bypass the passive, click-to-prescribe telehealth model. Instead, they require rigorous oversight from board-certified internal medicine physicians. That level of hands-on care carries a steep financial barrier, with baseline costs running between $450 and $600 every month. This comparison matrix maps out the two ends of the medication spectrum. Telehealth offers low costs but zero data and minimal support. Elevate charges a premium to deliver high-resolution biological data and constant medical support. We need to figure out if this strict, expensive concierge model is actually medically necessary to lose weight safely, or if it is an overpriced luxury for the average person. Elevate's protocol relies on mandatory in-person biological testing to establish how your metabolism is currently functioning. An RMR test calculates exact resting calories burned. Monthly InBody scans layer over this, tracking the fat-to-muscle loss ratio to ensure muscle stays protected. Armed with data, doctors adjust GLP-1 dosage in real time, preventing metabolic fragility. The immediate trade-off for this data is convenience. You cannot do this from your living room. It requires multiple physical commutes to their Los Angeles clinics every single month. The testing guarantees you are actually losing fat, but it turns a simple weekly injection into a heavy geographical and time commitment. The program is actively managed by board-certified internal medicine physicians, replacing the generic prescribers usually found on telehealth apps. This level of expertise matters heavily if you are trying to lose weight while actively managing complex conditions like hypertension, high cholesterol, or diabetes. Elevate also offers an advanced tier for $600 a month, and the main upgrade is the inclusion of 3 monthly IV therapy sessions. This scale weighs that cost against the biological benefits. IV therapy rapidly mitigates the severe nausea, dehydration, and fatigue that frequently hit patients taking GLP-1 injections. Opting for the advanced tier adds roughly $1,800 to the annual cost of your program for this supportive treatment. Paying for specialist oversight and regular IV infusions is an invaluable safety net for patients with complex medical backgrounds. But if you are an otherwise healthy adult just looking to drop 15 pounds, it is severe financial overkill. Elevate's administrative boundaries are rigid, moving away from the flexible pay-as-you-go structure of the telehealth model. Their financial policy requires the entire program to be paid in full upfront, and all fees are strictly non-refundable once you begin. The scheduling is just as strict. If you miss a required in-clinic session, you have exactly 7 days to reschedule it. These rules are designed to force patient compliance. They act as a filter, removing anyone who isn't entirely committed to a multi-month medical protocol. This creates a massive financial risk for the patient. If the medication gives you severe side effects and forces you to quit the program early, you forfeit your entire upfront investment. Let's break down exactly who gets a positive return on investment from this concierge service. This tree maps out the safety-first patient. If you have pre-existing metabolic conditions and live in LA, this program is a clear yes. We also have the data optimizer. These fitness-focused individuals pay a premium for exact tracking to protect their performance. For these two groups, the upfront financial risk is justified by the physical protection the data and the doctors provide. For these patients, Elevate provides the intensive clinical oversight necessary for long-term metabolic health. But there is a clear demographic that should avoid this clinic entirely, the budget DIYer. This routing shows the limits of the program. If you are healthy, on a strict budget, or live outside Southern California, this isn't for you. The non-refundable upfront costs and mandatory physical check-ins will immediately become an overly expensive burden. A basic pay-as-you-go online telehealth provider is simply the most practical and efficient alternative for this specific profile. Elevate Health Group offers one of the most rigorous, data-rich GLP-1 protocols available today, but its ultimate value is entirely dictated by your medical complexity and your zip code.